here now, and then before each of you leave us, we'll meet again to talk about things that you feel that you might need, services that could be coordinated for you. Okay, and please feel free to ask questions anywhere along the way. So the way that we kind of generally start people's stays and recommendations and get the ball rolling essentially is that when each of you came in, the therapist did their evaluations and doctors did their evaluations, and either I met with you or Rebecca met with you, the case manager, to kind of talk about how things were going at home before this, whether you had any equipment or services, or what kind of family supports or social supports you have. And we then took that information and shared it with the therapists and the doctors, and they brought their information in terms of meeting with you and assessing your condition, and that's kind of how we came up with those recommendations. It certainly varies from patient to patient, depending on each of those evaluations. I would say that a fair number of our patients, it's recommended that there's some type of assistance available for you when you go home. For some, it's someone there all the time, whether it's because the stroke has affected your thinking or affected your physical condition. That's often the recommendations. For some folks, it's someone checking on you every couple of hours or daily, someone checking on you kind of thing. So based off of whatever those recommendations are, either myself or Rebecca will come back and share that information with you. And in that first meeting, we also set a tentative discharge date. That date can always kind of change depending on how your progress changes and how your medical condition goes. Certainly we want each of you to be as medically stable as possible when it's time for you to go. So that plays a big factor in all of that. And then also the goals that they have set for you kind of determines or plays a large part in that discharge date. The average stay is about 2 weeks. Some folks stay up to a month, but that's kind of the general time frame that we work with most of the patients. So in setting those goals, the therapists also kind of have that general time frame in mind, and that's how they kind of gauge as to what can be achieved in that general time frame. And likewise, too, the level of supervision or assistance that you might need after that time frame. So, and plans vary from patient to patient. That's probably one of my favorite parts of my job, that although all of you might have the same condition, it certainly affected you differently. How plans come together is very different for each of you, and Rebecca and my job is to help you to the best of your ability put together a plan for when you leave us here so that you can continue on in your recovery. Unfortunately, the pretty standard thing for each patient is that insurance does not pay for someone to be with you all the time. So if when the team makes those recommendations, or depending on what the recommendations are, especially for folks who it's recommended that someone's there all the time, it's then our job to help you put together some type of plan, whether it is someone there all the time or someone checking on you every couple of hours, something so that you're safe and can continue on successfully in your recovery. So we kind of look at your social supports, your family supports, and see if there's anyone who could help you in that regard. For some folks, there is the option of hiring care, but it can be expensive at times, so that's not an option for everyone. And even fewer people have a long-term care policy, which is really the only option that pays for someone to be at home with you after kind of all of the medical services are provided for. So that's where Rebecca and I come into play in terms of helping you sift through all of this, because we really want you guys to be primarily focused on getting better and not have to worry about equipment or services, or making sure that you